Hello and welcome to the Auditing Antics podcast. So today I have a special guest here. I'm very excited about what we're going to dive into here. Bennett Borden of Clarion AI Partners is joining us, and he has a very large background in AI technology, the legal side of things as well. So we have already been talking some back and forth, and it seems like he has a lot of insight into pieces that we're missing in compliance and in healthcare, what we've been looking for and asking as we look at things like billing, coding, all of that, workflows for the clinical side. So very excited to have you here today with us, Bennett. And I'm going to go ahead and I'm going to let you introduce yourself so we have a good understanding of your background.
Thanks very much, Stephanie, and really delighted to be here. Thank you for having me. My name is Bennett Borden. I'm the founder and CEO of Clarion AI Partners, as Stephanie said. I'm a lawyer and a data scientist. And I became a data scientist a little bit by accident. I was in England, where I had put together my own degree studying turning points in history throughout 7,000 years of history, but especially focusing on technological revolutions. So everything from the wheel to the saddle to gunpowder, all the way up through the information age. And so studying history and philosophy and theology and sociology and anthropology and all the ologies, right, that don't necessarily make you any money. I've always been very curious about how society puts itself together, but especially how it's impacted by technological revolutions. And so in my senior year, I was actually approached by the CIA to come work for them in a data analytics division that they were setting up. And this is back in the early 90s. And I'm like, that sounds really cool, but I think you've got the wrong guy. Like, I don't really do data, not a huge fan of math, really hate statistics. I failed calculus. And they're like, yeah, we know all that. Well, that's not why we want you. So if you remember what was going on in the early 90s, the World Wide Web and email was coming out of academia into the general public. Cell phones were coming on the market. And so we were starting to create, as a society, a new kind of very personalized digital exhaust or digital contrail that we were putting out. And so the agency wanted me to help them figure out what they could learn from this new digital contrail about people or groups of people. Could we understand their behavior? Could we predict their behavior? Could we influence their behavior? Now, of course, this is something that every social media company, every app, every cookie, everything does now. But at the time, it was really pretty cool science. But my intention was always to go to law school. So I went to Georgetown Law after 8 years at the agency, and then went on to NYU to get a graduate degree in data analytics. And so I've spent my entire career kind of in big law, one of the top 10 firms. I began my career at Gibson, Dunn & Crutcher, and then ended up at DLA Piper, where I was chief data scientist, a partner, and head of their global AI practice. And so my whole career has been working at the intersection of data, law, and technology. And so before the advent of Gen AI, it was really all about automated decision-making systems. And so every time you applied for a credit card or a mortgage or a loan or a job, everything you see on your social media page, all the ads that you see, streaming service recommendations, when you check out from Amazon, when it says, hey, you should buy this too. All of those things are run by classical AI, is what they call it now, but algorithms. And algorithms are completely controllable. You write lines of code, they do exactly what they're meant to do, and it's just if then, if then, if then. So I was at DLA when Gen AI came out, and so was privileged to represent OpenAI and then Anthropic, and I'd represented Google, Microsoft, Amazon for many years. But I worked across all industries. It was really a wonderful privilege to be able to work in everything from healthcare and life sciences, education, manufacturing, defense, financial services, insurance, right? Just because everybody uses data to get insight for whatever reasons. And it's interesting, if you remember when Gen AI first hit the world in the fall of 22, there was all these meetings at the White House and briefings to Congress that I was heavily involved in. And I'm on the scientific advisory board to NIST, which created the AI risk management framework, which is a very popular framework. Very involved in the EU AI Act negotiations and working with many ministries of AI in various countries. And so was really involved as the world has been wrestling with this tremendous, powerful, transformative, disruptive, almost magically powerful technology. And realize that we are at a very important tipping point in the world where it's really important we get this right, because it is so powerful. It has tremendous, I'm a huge AI optimist. And so it has tremendous abilities to help in healthcare and education and material sciences and pharmaceuticals and just about everywhere. But it also has very dangerous capabilities in the wrong hands. So it was about this time that the head of DLA Piper asked me as chief data scientist to do an analysis of what I thought the impact of Gen AI would be on the practice of law. And so we took, we had a great data set, right? Lawyers write down what we do every 10th of an hour, right? And so took 10 years worth of 14,000 attorneys' time entries. And no matter what practice area, I think everywhere, from litigators to commercial to bankruptcy to wills and estates, right? And took apart, like, literally what are the steps that a lawyer takes to create a particular product or service, and how long does it take them to do that? And it turned out astoundingly to me that very consistently that every lawyer, no matter what their area of practice, basically does the same 6 or 7 things over and over and over and over again. And conservatively, 80% of what a lawyer does today is better done by AI. And so the Gen AI is an existential threat to how we have traditionally practiced law and many other knowledge worker professions. Throwing bodies at a problem and billing by the hour is just not going to survive. And so I kind of came to 2 conclusions at once. One, I did not want to spend the last 10 years of my career trying to save a sinking ship. I have been on the forefront of trying to bring technological efficiencies to very large law firms my whole career. It's very difficult. The billable hour model is just entrenched like a cancer into the culture of big law firms. But the other side of that coin is also true, that a law firm that is completely based on the power of AI can be a completely 22nd century kind of firm. And so took my core team and formed Clarion a couple of years ago, where everything we do is based on the power of AI, that we have created our own expert system of experts based on our 200 plus years of legal acumen and experience and work product and such. And we do kind of 3 things. So luckily, most of my clients came with me for AI counsel, which was just wonderful. So a great blessing to me. But like Walmart will call up and be like, hey, we're thinking about doing this thing. And we talk through the pros and cons, what AI laws, such as it is, might apply, but what other laws apply. Because AI regulation around the world is very fluid and mushy, and it's going to stay that way for years. But the two things we do that I love the most are, one is AI strategy for a company. Like, how do you bring AI into your operations to supersuit the company? And so we use this analogy all the time. Think Iron Man, not the Terminator, right? So you're not going to like unplug a person and plug in an AI system and ta-da, you're all done, right? It's much more like Iron Man, where you've got a human who's very smart, lots of years of training, lots of acumen and history and experience, and you can take that and augment and extend and do things you could never do before by surrounding those people or that person with enabling technology like AI. And so our whole kind of thing that we truly love to do is this supersuiting of companies, right? Taking their secret sauce and amplifying it. And then the most unusual part of what we do is we are actually an AI development shop. And so we build AI-based solutions for clients. Everything from small knowledge bots to giant multi-agent systems with orchestration layers and all of that. And our lens is one of legal, right? So we have this concept that we call governance engineering, where when companies are trying to take advantage of their own acumen and trying to build or incorporate AI systems, are they also properly building in compliance mechanisms, translating the words of laws and regulations into technical specifications that run with the AI system, that spit out the evidentiary artifacts you need to defend that you're doing what's reasonable to whoever comes knocking. So a bit of a long intro, but I've had a bit of a long career. But that's who we are and how I got here.
Yeah, no, that's great. That's great. And a lot of what you're explaining and talking about, I can already piece it together to certain areas in healthcare where we really have unknown components. And I was telling you before, there's a lot of fear that exists in the industry because you may have certain people in compliance positions, for example. They know that these steps need to be taken. They have no idea how to do it. And then they have administration pushing down and saying, this isn't optional. We are adopting this, figure it out. And then, not really letting them even have an input, no insight into it. So it's been a real issue right now currently. And one thing that I think is interesting that you're describing here is how you can build a monitoring plan. And it sounds like that's what you're referring to, that you all develop as well. It's one of those things where I'll talk a lot, for example, to different developers in different capacities. Sometimes I do consulting with AI developers. Sometimes there's others, just so they can better understand the healthcare landscape. But a lot of times when I'm dealing with my own defense work, for example, when I'm working a legal case, there's a lot of times where the outcome is negative for my client, and then the company where they've purchased this product, software, whatever it may be, has that hands-off approach. Yeah. And I think, largely that's where we have a lot of issues right now, because administration is not understanding the fact that the company knows that they're selling you a product and you're required to monitor that. From that perspective, do you have any thoughts or insight as to where people can begin to, formulate a plan, more so in larger hospital facilities, if they are, looking at the fact that they didn't have a choice in implementing it and now they've got to oversee it?
Yes, for sure. And we work with, just like you do, AI companies and AI purchasers, customers of AI systems. And one of the most important pieces of governance is kind of the due diligence piece. I hear this from CEOs of hospital healthcare systems, boards. They feel this pressure, right? We've got to do something with AI. We hear that AI, but I don't know how to think about it. I don't really understand it. And I always push back and say, but you do understand what you do, right? You are experts at what you do as a healthcare system. And so you're not starting from whole cloth. You already have all these controls in place and metrics in place. And so the question is not creating some whole new system from nothing. It is, if I introduce AI into a particular workflow, how does that change my risk profile? Can I reasonably mitigate that change? And can I prove it? And it's that proving layer that's going to become so important. And so from the highest levels, when you're evaluating whether and how to bring AI in, it's important to be able to fall back on the bedrock principle of the law, which is reasonableness. And what that means is, did you identify reasonably foreseeable risks? Did you reasonably try to mitigate those risks? And can you prove it? And it's the can you prove it layer that most people fall down on. It's important in that overall kind of schema to realize that it is the hospital or healthcare system that is on the hook for any AI it uses, whether it's a vendor. So a lot of what we're seeing is kind of electronic note taking. So the doctor's notes that used to be transcribed by humans is largely being taken over by AI. Those systems are getting better and better, and it's just simply inevitable. It's every technological revolution. There are some positions or jobs that are just virtually eliminated, and this unfortunately is one of those. Medical coding, that whole industry is really going to be disrupted because it is AI is getting better and better at it. But it doesn't mean, let's say you as a health system decide to bring in one of those systems. It doesn't mean that all of a sudden, ta-da, great, we're all in compliance and everything is rosy. There's due diligence becomes even more important because it is not the software company that is going to be held to be responsible for the outcomes. It's the healthcare system. And that's true of any industry where the law is shaping up, both federally, the EU AI Act, the state laws that we see coming into effect. It's not the developer of the system who is held liable. It's the deployer of the system, the people pushing the buttons and at the healthcare system that are being held responsible. And so one of the things is really, really look into these companies, make them prove to you the accuracy of what they've done. Run proofs of concepts or pilots. And even when the thing is up and running and you think it's good, work in a occasional monitoring or almost like an internal audit schedule, so that every month, every quarter, you're pulling the recordings of a statistically valid random sample of the recordings, looking at the results and seeing what the accuracy level is. It's an important part of governance to monitor these AI systems on a going forward basis.
Well, and it's interesting because as you're explaining all of this, my mind's going a million different ways. But one of the core issues we have in the industry to begin with is that compliance is not looked at something in the budget that, is a definite, that it has to be there. And when I see different clients of mine, for example, choosing to partner with a vendor and pay all this money to a vendor that's promised them, sunshine and rainbows, they think that means, oh, we now take our compliance budget and we put it over here, or we can drastically reduce it. We can cut all this money, all these positions, and then we have a tiny piece for compliance, and then you tell them to deal with it. So it's something where I think, for example, we are going to have a lot of issues in the healthcare industry where people are going to find this out the hard way. And then after the CEOs and the CFOs and COOs are feeling the pain of being held accountable, then maybe we're going to start to see some changes. Because a lot of the organizations that I'm working with, one in particular is very large, and to just see the rash decisions they're making with very little oversight, and they think it's fine because the company tells them it's fine, is going to have large repercussions, I believe.
I agree. And it's really important. Like you're seeing across industries, some of them are just leaning into, oh, yeah, this AI thing's going to be great, and we're going to fire a whole bunch of people. One, some of those companies are using AI as an excuse just to cut the bottom line. But two, it's too early to do that, right? You need to adopt AI in a very deliberate, controlled, monitored way. So that you know precisely what it can and can't do. Because AI, I'm a huge AI optimist. AI has this ability to just utterly transform so many parts of our society: education, healthcare, pharmaceutical, material science. It's just all over the place. It can do this incredible good, but it has its limitations. And so all of these models are literally the largest compendium of human knowledge ever assembled, as well as a whole bunch of junk. And the problem is it can't tell the difference between what's true and what's junk, because we've fed it things like scholarly articles and medical textbooks and, all this really good stuff, but also like every fiction book on, fake stories, right? And so it doesn't know the difference. And so if it's not controlled properly, it gives answers that could be from some Dan Brown book as opposed to like from actual medical science. And so asking questions about precisely what these products are trained on, what QC they have in place, prove it to me, right? Like it's those questions that are just critically important, and realizing that just like you would never say, so a vendor comes by and says, hey, look, I have this new robot that will do all these things and it'll be great. No hospital in the world just goes, okay, and just hires it and just let it take over a job. Well, the due diligence is you put into a new procedure, a new system, a new drug, a new whatever it is, it should be applied to an AI system just as strongly.
Mm-hmm. Now, when you were talking about monitoring, one of the things that came to my mind, one of the scenarios we're seeing a lot of issues with currently is what I would view as some of the basics of healthcare, which is patient consent. And a lot of organizations that are adopting ambient scribing, I'll say, that's one of the first questions I ask. Do you get patient consent? How are you educating the patient on how this is set up, how it's working? Do you know how it's working? And it's been interesting because I've been seeing different things just publicly. For example, on LinkedIn, one of my friends and colleagues in the industry, she went to an appointment recently and just slapped on the wall was a notification that they're using ambient scribing. That's not personal consent. And she also wasn't asked beyond that to sign anything, to, consent verbally to anything. It's just this notification on the wall. I've also seen things like different videos on social media from, people that are saying they were in their psychiatrist's office and they're asking if they can record them. And then the patient starts thinking, like, where are you storing this? Who has access to this? And, you were talking about testing a system and looking at it from each angle. And just when we think about consent alone, a lot of practices in really large hospital systems aren't paying attention. They just know there's a process. They don't know who's following it. And I think it's going to be really problematic, especially when we have things like patient portals when they can view their notes.
Yeah.
I had seen, a patient saw in the note, it said, I consented to AI and he didn't. And then he wanted them to pull the recording back and they had no idea where that was even located or how to get rid of it.
Yeah. And the interesting thing about consent is it's really being driven on the state level. If you look at what's coming out of the FDA, in January, they published kind of some preliminary guidance on the use of AI. This administration is very pro AI, deregulation, let industry handle it themselves. And so the advice that's coming out is very broad. And even the final rules of the FDA aren't out yet. They closed public comment in April, but the final hasn't been released yet. And so what you're seeing is states stepping into the gap, and these state laws vary. Some of them are passive consent. So sticking up a thing on a wall is just fine, right? Some of them, the minority of them, are active consent, like you have to push a button or sign a thing, right? But a hospital or any other kind of healthcare system, you are the one responsible for the accuracy, for obtaining consent correctly, for recording the act of that consent. And even if the state law only requires passive consent, consider active consent. Why wouldn't you? Administratively, it might be harder, but you've already got them filling out like 1,700 forms. Just add one, right? That talks about consent. But knowing where and how that data is stored, protected, but used, because this is a problem generally with all kinds of AI systems in healthcare, is that these are software programs. And so they're governed by software law, which means it's nothing but contract. And so it is the terms of the license or the terms of the contract that control everything. Who's responsible for what a vendor will guarantee or say, or what they will comply with, and what they push off on the healthcare system. And most software companies will push off as much as they can. Like they won't, their reps and warranties and their indemnification provisions are just like any other software that says, our damages are limited to whatever you paid us the last 12 months. Well, that's just ain't good enough, right? So one of the red flags in an AI system is looking at the contract and how much skin they're willing to put into the game, that they are willing to keep some of that liability. That shows you they have confidence in their own product. If they're just falling back on software terms and just shoving all the indemnification and all the liability and stuff off to the hospital, one, it should raise some red flags, but two, that means your due diligence should go way up. Prove it to me, prove it to me, prove it to me, right? And then run a pilot at their cost, right? They shouldn't, if they're buying their product, they shouldn't have a problem with that, right? And so this is where it's really important to understand that it is not the developer of a system that is held responsible. It is the deployer of that system, the hospital system, that is held liable. And so unless, because it doesn't fall, software, it doesn't fall under product liability law. And so like the normal stuff we think about, oh, I, used a pen and it, broke into shards and stabbed me in the forehead. Those laws don't apply to software. So it's really important to pay attention to what these contracts and licenses say, because that will define all of the parties' separation of who's responsible for what.
Now, can you speak to as well the malpractice insurance side? So obviously that's not my main focus, but when I'm trying to figure out the regulatory requirements for documentation, coding, and billing, I still in the back of my mind have to think about the risk from a legal perspective outside of that, and when we may need to have discussions with someone who does work in that particular area. So for individual physicians and practitioners or these hospital systems, what does that look like when they're, when they have their average malpractice insurance policy? Are there a lot of riders that can be added in, or how does that look?
Yeah, that's what we're starting to see. So it's kind of like when cybersecurity became a big issue, a decade or two ago, where you would start to see cybersecurity riders or separate policies entirely on regular business or malpractice insurance. Same with lawyers. And so it's really important to have a conversation with your insurance provider. Sometimes you're seeing notices come out saying we don't cover AI related stuff. Some are saying we do, and here's our new product, come buy this product, right? But it's important to know where you're protected and where you're not. Some insurance providers will protect or insure against some kind of AI systems and not others. And that's usually around diagnostics. And the thing about AI is really good at diagnosing certain things. But it's really important to remember that these diagnostic systems, all Gen AI systems, are probabilistic in nature, right? So they're going to give you the most probable answer. Well, that's great. But if you've got a bell curve, the people at the edges are the ones who get screwed, right? And so it's really important to understand what you're protected against and what you're not, but also understand, and these are questions to ask of an AI diagnostic tool. Well, how do you deal with edge cases? How do you look for the non-normal distribution, like things like that? Because what we're seeing is that the most powerful systems are what we call hybrid systems that have some pieces of our good old-fashioned algorithms, classical AI, which are deterministic. If this, then this. If this, then this, right? And that can be really useful. You want the AI, the Gen AI, for deep analytical and looking for patterns. And this is why it sees patterns in different ways, which is why we're seeing advances in pharmaceuticals and proteins and antibiotics and things like that. But when it comes to a diagnosis, you want the answer, not an answer, right? And so really diving into these systems, how they work, how do you know they work, how can you prove they work, is absolutely part of the due diligence. But then it's important, part of what the monitoring piece is that you can do independently is you can always, people are like, oh, these things are such black boxes. Even the people who make them don't understand how they work. Well, maybe, but you do always have a view into where they touch the world. So a diagnosis, a code, a transcript, whatever, right? And that you can always measure, and that is where you get in trouble anyway. And so putting in some sort of appropriate monitoring for whatever the thing is doing is how you build your defensibility.
Okay. Now, I know a lot of my listeners and people in the industry are very curious, and you touched on this a little bit in the beginning about the coding industry, the medical coding industry. And it's one of those things I've started to talk about it quite a bit on the podcast because I'll just give my personal view here real quick. I have a lot of frustrations when we see different education systems, for example, trying to continue to sell basic CPC coding, for example, the entry level coding programs, when we know as an industry this is completely changing. And there's a lot of questions around what that's going to look like. Of course, these entities that make their money off of education, off of certifications, they're trying to pivot to spin a different look on it. But at the end of the day, I know sitting here, seeing the day-to-day work, a lot of it can be automated. And as much as I'm going to preach to the fact that we need compliance, that we need monitoring and oversight, I do realistically know that medical coding as we know it, just like a lot of medical billing, can be automated and is going to go away. So my viewpoint looking to the future is that those that were in more of that position that can be streamlined are going to have to look a step further and look at things like compliance, digging more into the regulatory side. But as we are as an industry, I can't picture how it's going to get there, because what I'm seeing is we're going to have this stop in time where organizations are largely going to use AI assisted software. We've talked about a lot of the human in the loop component as being offshored for cheap labor. That's definitely going to continue happening. So I see this like spot in time where we're not going to have as many new people coming into the industry learning. And then up here at the other end, we have people like myself who have worked for years in the industry. And, myself personally, I have so much experience and am able to do so many different types of consulting projects because of my hands-on experience. So my question here is, what does this look like in healthcare? I'm sure you've seen it in other industries as well, but what does this look like as far as training these people and bringing them in where I can't give them my experience, if that makes sense?
Absolutely. And many industries, especially even like law firms, right? Because the way that we learned is you got thrown into the trenches and you did all the grunt work, right? And then that's how you learned how a thing got done. But that grunt work is going away. And so like law firms are really struggling. Law schools are struggling with how do we get that experience translated into training in a new way. And so this is the beginning of any technological revolution is always the most disruptive. And it's unfortunately sad, but true that 18 to 24-year-olds or so are the most affected because they've been trained and educated for a world that doesn't exist anymore. And the training and education mechanisms haven't adapted to train them right for the new worlds that are coming forward. And so companies have to step into that gap and be very purposeful with how they train people. And what I speak to a lot of youth groups, a lot of people about work in education quite a bit. And what I tell these younger people is you have to be your own Prince Charming. Nobody's coming to save you, right? Don't rely on your employer to set up some system to save your job and to retrain you. It's like that movie Hidden Figures about the people who, a space movie, right? Like where they're going off into space and these women calculate all these massive things by hand, right? But then there's this IBM computer that comes in and they're made irrelevant. Well, the smarter people learn the language of the new system, right? That's the kind of thinking. So how can you use the experience you have to go with this technological change? Can you become part of the monitoring system? Can you become part of the human in the loop? Can you whatever, right? This is where and it's really cool to see, because it's at the perfect time sociologically as well. Because like with the advent of social media, we as a society did not handle that well at all. Like social media did not set out to like destroy the lives of people, but it did. And especially there, it's not a coincidence that the most connected generation in the history of the world is also the loneliest and has the biggest mental health crisis. But those people who are raised in that original kind of world are now parents, and they're raising kids who are very different, have very different feelings about AI and fairness and all this stuff. And so you're seeing these people become politically active and getting very involved in regulation it's interesting that the generation that is now going to be the most disruptive with AI is almost more prepared for it, and to be their own Prince Charming. And so that's why you're seeing so many original startups. Like so many people say it's easier to start a new company than it is to get a new job, right? And so I have this mixture of concern, but also great hope in this section of our society. But it is just facing the reality. Change is upon us. Nothing is going to stop it. And so what skills do you have? What can you bring to the market? What can you, the new ideas that you can do? How can you learn Fortran at IBM and the analogy, right? It is going to be up to you mainly, or be the voice that convinces the employer to retrain the people. Like, right? It's be your own Prince Charming.
Yeah. And, that to that point as well, different organizations are looking at technology in different ways. I've talked about the one where I have that client, they've completely outsourced everything and it's been very disruptive. I have others where administration is very hesitant. They see the value in compliance, they see the value in the person that's the human in the loop having actual experience as opposed to just passing a test, for example, and claiming you have experience. So I think we'll see varying degrees of how this is going to impact everything. But we do also have in this industry, if we think at just the base level of coding, for example, there's a lot of entities out there where they will outsource. They'll be the outsource company for very large hospital systems with hundreds or thousands of physicians and providers. And those are the types of groups I think we are going to see making decisions to largely, move away from that. But I think that, just like anything else, we need to keep getting the word out there. Like you've been saying, due diligence, because it's always up to you to pay attention to what you're being told. And there's so many times, so many legal cases I've been involved in where the physician ends up owing a lot of money back. And it's because they were believing the salesperson. They were believing the company's hired consultant and what they were telling them. So even on a personal level, for people that are going through the education system or just out of that now, I think we have to continue to get the word out there that it's more than just, learning the CPC book, the ICD-10, the guidelines. That's all base level now. That's all very easily automated.
Table stakes, right?
Exactly. You can feed it in and the system can figure it out. So I think it's just one of those things where through platforms like this and talking to different people, we need to keep getting the word out there, because it bothers me in any industry when I see people continue to sell a product and continue to sell something just because that's their business model. They're trying to pivot just like everyone else, but it's like, okay, to what extent when you're not being truly honest, which some of that goes back to my earlier days when I started to seek out higher education, and there were some issues with an organization I chose to go with that wasn't being honest, and I didn't know enough to look into it. So just trying to get that out there. Now, to finish up for the day, do you have any final tips to somebody that is working in healthcare and just doesn't know where to begin? If they sit there feeling lost or hopeless, what advice do you have?
Honestly, I have different advice for kind of different kind of levels of people in organizations. At the top, you've got to lead into this. One of the biggest mistakes that companies make is that they spend too much time trying to defend how they have historically been successful. That is not the time that is not this time. If you look at the list of the top 100 companies before the second industrial revolution and the top 100 companies afterwards, there's only 2 or 3 companies on both of those lists because these guys waited too long to take advantage of this new technology. So it doesn't mean you have to be a trailblazer and rush out there and, right? But it does mean you've got to learn how this brave new world and figure out how to do so safely and responsibly and defensively. For those who are lower down and even on a personal level, this is the first technology we have that will actually teach you how to use it in the very best ways, or teach you how to react to it in the very best ways. So any of you, pick your favorite Gen AI chatbot, use a paid version. So if there's anything I can get across to you, consumer-facing free versions of these tools do not provide you with the privacy protections and things that you need. So if you have the paid version, the terms of service say things like your data isn't used to train the models, your data is not intermingled with other people, that gives you certain privacy and identification kind of protections. The free versions don't have any of that because there's this famous Silicon Valley mantra, right, that says, if you're not paying for the product, you are the product, right? And so they want you for your data, right? So put that aside, but use a paid version. The $20 a month is worth it. And you can sit down and ask it anything you want. Like, hey, I'm a nurse, or I'm a coder, I'm a whatever, and I want to understand AI better and what effect it's having in my profession. And can we put together a lesson series for me to understand this? And what should I do? Here's my skill set. Is there a way to monetize this? What is that, right? You can just ask it, and you'd be shocked at how helpful it is just to sit down and have a conversation with the world's largest compendium of human knowledge, right? Now, I tell people all the time, we know these things hallucinate. The reason is because they, like we said, they have a whole lot of really factual stuff and they have a whole lot of not factual stuff, and it sometimes doesn't know the difference between those things. And so I always tell people, when you're asking questions of these bots, treat them like you're cross-examining them on the stand, right? Like, where did that answer come from? Are there other conflicting answers? Has there been, professional debates around this issue? Things like that, like prove your source, depose your witness, right? And you'll get much better answers out of it. But it is an incredible source of advice for exactly where you are in your life, exactly what tools and experience you have, what your desires are. It can really help guide you even in the use or displacement of the very technology that you're seeking guidance from.
Well, thank you for that. And that's a good point because I know even for myself, I've been trying to learn how to navigate learning the systems, even between something like Claude and ChatGPT. And they work very differently. I have to be careful in my position. You can't just throw anything into AI. So yeah, that's a really good point to go to it to learn how to use it. That makes sense. All right. Well, I want to thank you so much for taking the time to come on the podcast. I know this is going to be a lot of very valuable information. Like I was telling you, we don't have a lot of sources out there right now in compliance and definitely in medical coding and billing that are shedding some light on this. So I think this was a really good conversation. People are going to take away quite a bit from this, and I thank you for that.
Absolutely. It's really, thank you. It's a pleasure to be here. And we do a lot of just free philanthropic counseling. I'm very big on educating people on AI. So please feel free to reach out to us at clarionai.com. We will happily have conversations with individuals, with systems, with providers, with AI. We want to spread the good news of how to be good with AI. So please don't hesitate to contact us. And Stephanie, thank you so much for having me on today.
Yes, thank you. And I'll make sure in the show notes we'll have all the information to contact Bennett, the organization, all of that. So thank you, and we'll see everybody next week.